Thank you for joining us. My name's Dr. Fiona Campbell. I'm co-director of the Pain Center at the Hospital for Sick Children, where I also treat kids who live with chronic pain. I'm absolutely delighted today to be with my friend and my colleague, Dr. Mike Salter, who is a pain scientist. He's very famous all over the world. And we've asked him to come and join us to really explain the science behind pain. What do you think the biggest unmet medical need is when it comes to pain?
So I think there's two ways to think about this. For acute pain in particular, there are many very good treatments. You as an anesthesiologist use these treatments, largely pharmacological agents, to suppress pain in your patients in the operating room and after when they're recovering. So for acute pain, we have a lot of tools that can be used, largely pharmacological, but some non-pharmacological. So one aspect of the unmet medical need is making sure that the tools that we have to inhibit pain when it's appropriate to do that are there and get used. So there's that here at Sick Kids, that happens a lot, but not everywhere. So that's one aspect of the unmet medical need. And then the other component of the unmet medical need is really the bigger problem that many of us are concerned with, which is that upwards of 15 to 20% of individuals have chronic pain that isn't treated adequately by any of the pharmacological or non-pharmacological therapies. And that, for me, is the part of the unmet need that a lot of research is devoted towards, is to coming up with new kinds of therapies, understanding the neurobiology and neuroimmunology of chronic pain, and then trying to be clever enough to come up with new types of therapies.
So acute pain, we need to do a better job of treating that in hospitalized children in the operating rooms, and we probably do quite a good job of that in some centers, and other centers probably need to do a better job of that. But for nearly all clinicians, if you like, we need to find better therapies for chronic pain because we don't have very much that's really good, particularly in the pharmacological realm.
Exactly.
Okay. Well, thank you very much, Dr. Salter, for joining us today. Really providing an excellent and understandable while comprehensive view of the science that underpins pain. This is so important.
Thank you, Fiona, and it's a pleasure to be here.